Hello, my name is Roisin and welcome back to my channel. This week is Arthritis Awareness Week, so I wanted to take the chance to talk to you about one of the chronic illnesses with which I live my life. I actually have several different chronic illnesses because they are like Pokemon and you gotta catch them all, but today we're going to talk about the one that I think I would consider my main diagnosis. I guess before I was medicated for it, it was my most debilitating illness. Although now my migraines potentially are worse. So that condition is a form of inflammatory arthritis called psoriatic arthritis. Itis, medically, just means any form of inflammation. For example, I am currently dealing with the flare-up of something called costochondritis, which is an inflammation of the connective tissue in between your ribcage and your sternum, and it's quite painful. And most people, I think, have had tonsillitis at some point in their life. Arthritis is the inflammation of your joints. I think the type of arthritis that most people are familiar with is osteoarthritis, which is the most common form of arthritis in the UK, and is because over the course of your life, for some people, the collagen between your joints, the protective barrier between your joints, eventually gets worn down, and that can lead to inflammation, to pain, stiffness and swelling. And that form of arthritis mostly affects people who are over 50, which is why some people are surprised to learn that I developed arthritis when I was around 19 years old. But there are actually lots of different types of arthritis, for example, rheumatoid arthritis or juvenile idiopathic arthritis, and the type that I've been diagnosed with, psoriatic arthritis. So psoriatic arthritis is a type of arthritis that affects people with psoriasis. Most people will have psoriasis before they develop arthritis, although for some people it does happen the other way around. Psoriasis is another autoimmune condition which affects the skin. Basically, your immune system thinks that your skin cells are an invading enemy body and attacks, causing your skin cells to die. But because your skin is so used to dying and regenerating all of the time, when your immune system does this, your skin cells just regenerate. So this means that a person with psoriasis, in the places where they have psoriasis, their skin dies and regrows at about 100 times the normal rate. So this causes a rapid build-up of dead skin cells and also inflammation. So it can cause itchiness, redness, flaky, scaly patches on various different parts of your skin. The most common places to get it are your scalp, your elbows and your knees, although you can get it on anywhere that you have skin. When I was at my worst, I had it on roughly 15% of my skin, which doesn't sound that high, but basically every body part that had skin, I had a little bit of psoriasis there somewhere. I will put some pictures here to show you what I looked like at that time. There are other types of psoriasis, such as guttate psoriasis, which usually happens after someone has had an infection and goes away. And there is also flexural psoriasis, which is psoriasis that occurs anywhere that your skin touches your skin. So in your flexures, so that would be the inner elbow, the armpit, where your legs meet your trunk, under boobs. All of those areas can also get flexural psoriasis, which is more red because of the rubbing and often moist and prone to cracking. I developed the skin condition psoriasis when I was around 14 years old, which is pretty common. Most people develop psoriasis at the onset of puberty. It isn't really very well understood why some people who have the skin condition psoriasis go on to develop arthritis associated with it, although it is something to do with the higher levels of inflammation in your body. But I had pretty severe psoriasis, as I've said, and I also had nail involvement. So I had psoriasis in the nail beds underneath my nails, which is a pretty good indicator that you are going to develop arthritis at some point. And I did end up losing a toenail at one point as well because of that. So because of those two indicators, it's not that surprising that I did develop arthritis. Although it is slightly surprising because, as well as with osteoarthritis, most people who develop psoriatic arthritis are middle-aged, over 40 instead of over 50, but still. And also, it is most commonly found in your dactyls, so your fingers and your toes. And my hands are not arthritic at all, and nor are my feet. I managed to develop a rarer kind of psoriatic arthritis at a very young age, which is probably why it took longer for them to work out what was actually wrong with me. I have what is called spondyloarthropathy, which is arthritis of the spine. And then I also have sacroiliitis, or my pelvis is involved. And then I also have some arthritis in my shoulders, in my the ball and socket of my hip joint, and in my knees. So just like psoriasis, psoriatic arthritis is an autoimmune condition where your immune system attacks the connective tissue in your joints, ligaments and tendons, causing widespread pain, stiffness of joints and swollen joints as well. The stiffness is usually more noticeable in the morning, and people can find it takes up to a couple of hours for them to be moving comfortably. And as I said, tendons can also be affected, which is why I ended up in A&E unable to move this elbow at one point, and was diagnosed with tennis elbow, which is tendonitis, but was actually related to my psoriatic arthritis. I don't play tennis. So as I said, I had psoriasis from when I was 14, and it was pretty severe by the time I was diagnosed with psoriatic arthritis. Although I wasn't actually referred to a dermatologist until after my psoriatic arthritis diagnosis. I was instead trying to treat it with topical creams such as steroids, which I had a bad reaction to, and vitamin D analog creams. It was quite labour intensive having to do that twice a day. It also, because I had it on my face and my hair was often greasy, it was also in my scalp, and it never really cured anything. It just kept it from being as bad as it could have. I take immunosuppressants now, and according to the dermatologist that I saw, I would have been a candidate for those immunosuppressants even without the joint involvement of psoriatic arthritis. My skin was bad enough for it to be worth making my immune system a little worse. And that's kind of why I find it a little bit frustrating that it took so long for me to be diagnosed with psoriatic arthritis. I didn't get diagnosed until I was 25, and as I said, I started developing the pain at 19. So I was sitting in front of these GPs and other doctors with my face flicking off because I had such bad psoriasis, but nobody considered that it could be the well-known associated arthritis. Like I said, I had painful joints, particularly my hips and shoulders were the most noticeable. And I remember, like, at university doing a lot of stretches, thinking it was just tension in my muscles, doing yoga all the time to try and relieve some of that pain, and it never really going anywhere. But when I was 23, I got a lot worse, and I was sick in other ways. Various other conditions that I mentioned at the start began to flare up when I was about 23, and so I was struggling with my digestion, I was losing a lot of weight, and I was in pain and fatigued all the time. Since then I have had an MRI which says I have 2 slipped discs in my back, and I think that it was at 23 that I slipped one of those discs, because it was when a lot of the nerve pain started, and a lot more of the stiffness and difficulty getting up in the morning. Of course, that could also be associated with the fatigue that I had from not being able to eat properly. So there were various different things that meant I started going to the doctors and being a lot more persistent and insistent that something was wrong, and I needed help. I found that I had to advocate for myself a lot when I went to see doctors. I was often dismissed with syndromes that they don't treat, really, and I know that those are serious things that other people do experience, but I found that I was often just given a fact sheet and sent away, which is not the most helpful way to deal with someone who is ill, to just get them to do it all by themselves. Eventually my GP thought that I had ME and fibromyalgia, because of the chronic fatigue and the widespread pain, which characterize both of those conditions. But as both of those things are diagnoses of elimination, meaning that you have to rule out anything else before you can say that someone certainly has those things, I was sent to various different doctors and specialists to test me for everything else. So anything on your body that can be ultrasounded, I have had ultrasounded. I've had MRIs and CAT scans. I've been thoroughly, I've had a thorough MOT of my body, which does mean that I know things like my lungs and heart are perfectly fine, which is, you know, a bonus. But it wasn't until I got to see a rheumatologist who took one look at me and said, I don't think you have fibromyalgia, I think you have psoriatic arthritis. And then it took longer after that for me to actually start the treatment that I am currently on. So as I said, I was diagnosed at 25, but it wasn't until 27 that I started taking the immunosuppressants that I currently take. Let me find a thing for you. So I currently inject myself with a biologic every other week. My biologic is an immunosuppressant, and biologics are drugs that use genetically engineered living organisms, which some vaccines do also use, so it's not like a weird technology, but the drug that I take had only been on the NHS for about 6 months before I started taking it, which means that it's expensive, which means that I had to try all of the other cheaper options before they actually put me on the good stuff. So I had to take a low dose of a chemotherapy drug, which made me very sick, then an intense non-steroidal anti-inflammatory drug, which is basically like super strength ibuprofen, which also made me sick as I have chronic gastritis. My new drug works really well. I sometimes struggle with the act of injecting it because there's just some sort of mental block about stabbing yourself in the stomach that I struggle with, but it's basically reduced my pain by half, I would say. I'm able to function a lot better than I was when I was unmedicated, and my psoriasis, my skin has almost completely cleared up. I have a tiny patch at the back of my head here and a little one on the back of my neck, but for the most part it's completely cleared up. And the best part of this is that there are absolutely no side effects, which I love, apart from the fact that I have a reduced immune system, and I started taking this in January 2020. Very scary time to begin your immunosuppressant journey. The only other medication that I take that is prescribed to me is a tricyclic antidepressant, which I take on very low doses for nerve pain, because as I said, I have 2 bulging discs in my spine and they can sometimes sort of lean on nerves and cause like shooting pain down my arm and things. So I have to take the tricyclic antidepressant for that, as that is like a physical issue that cannot be cured with reducing my inflammation. So as I said then, I am not completely without pain by any means. I have been having some other tests to see what might be causing my continued pain and things like the costochondritis that I mentioned at the start of this video. The most recent rheumatologist that I saw thinks it might just be pain from the fact that I am hypermobile, so my joints bend in ways that they are not supposed to, and that can cause pain. So as well as the medication that I've mentioned, I treat my joint pain in other ways. As I already said, I have chronic gastritis, so I try to limit the amount of ibuprofen I take because that is not fun. And paracetamol basically doesn't touch my pain. Sometimes I will take codeine, but again, only when it's struggling to sleep levels of pain. What I do use a lot for my pain is heat. Although Lena Norms made a video talking about the expiry dates of hot water bottles, and I was already quite scared that they were going to burst before that. So now I try not to use them unless it's really bad. Hot water bottles get a lot hotter than other things that you can use, but mostly I use my heat pad and I use hot baths. I have a hot bath pretty much every day. And I know that hot baths do work for me, so even though it feels a little wasteful to have a bath every day, when I last summer had a growth on my knee that had to be removed, I wasn't allowed to have a bath for 2 weeks while the stitches healed, and I really felt the difference in my pain levels. I also usually use Epsom salts in my bath, which are magnesium salt crystals, and they help to relax your muscles. I haven't done a test of bathing without Epsom salts and bathing with Epsom salts to see whether it's the heat or the magnesium that does the most work, but I feel like it's worth putting them in anyway. I also have some tools that I use to help me live my life better. I have a walking stick, which since I have been medicated, I haven't had to use half as much, possibly only a handful of times since then. But I also, as I said, started my medication at the beginning of the pandemic, so I've been seeing fewer people, and maybe if I was exerting myself a little more, we would see that I would have to use my stick a lot more. I'll see how it goes over the next few years, but I definitely think I need it less. I also have other things such as this arm attached to my bed for holding my iPad for when I'm fatigued and because I have pain in my shoulders and back, and also this pillow that I use to support me because of my slip disc, often it is more comfortable for me to sleep in a slightly elevated position. So if you have any questions, please do let me know in the comments down below. Any questions you have about psoriatic arthritis or about how I deal with pain, I would love to talk to you in the comments. I have searched on YouTube for other people talking about their personal experience with psoriatic arthritis, and I couldn't really find very much. Most of it is doctors talking about it. So if you do find this helpful, please let me know. And thank you for watching. I don't make as many videos about my chronic illness as I thought I would when I first started. So if there's any other videos that you would like me to make talking about this, let me know in the comments and I will do my best to do that. Thank you for watching. Please remember to give this video a thumbs up if you liked it and to subscribe. I tend to put out new videos twice a week. Usually they are about books, not about my illness. And I will see you again very soon. Thank you for watching. Bye bye.